Hello, everyone. Welcome to this session on our new reality, AI transforming health and care. I'm your moderator, Solome Tibabu, and we have an amazing panel today. So before we get started, how about we just do a couple introductions?
Hi, everyone, and thank you so much for inviting me here tonight. It's a great pleasure. My name is Alison Darcy, and I'm the founder and president of Wobot Health.
And hi, everyone. I'm Shannon Hooper. I'm the Chief Strategy and Product Officer at Behavior.
And I'm Jen Horenjeff. I'm the founder and CEO of Savvy Cooperative.
Great, thanks. And now for those who are unfamiliar, why don't we get into a little bit about what each of your organizations do? Alison, back to you. What is Wobot and how are you using AI to transform mental health care in particular?
Right. Well, Wobot is a relational agent, and what that means is it's software that's capable of developing a working alliance or a therapeutic bond with users, and we think that's really important because what we do is the promotion of mental health, really through building digital therapeutics, that Wobot guides people through. So it's currently an app available on the phone, and we are building a suite of products, some of which we hope to bring through regulatory process, and others are distributed through our health partners.
Amazing. I know you've done some wonderful work around therapeutic alliance with patients and Wobot solutions. So excited to dig in more. But first, I'm going to go over next to Shannon. VR is becoming ever more popular in healthcare. How is behavior transforming mental health care?
Yeah, absolutely. So Behavior is a digital therapeutics company focused on bringing mental and behavioral health treatments to market via, as you would imagine, virtual and augmented reality. And we really do that through multiple different pathways. We have some solutions that, similar to what Allison just shared in Wobot, we're bringing to market through partners, more general wellness types of pathways. Others that we are looking at more regulated pathways as prescription digital therapeutics. But maybe to your point around like VR becoming more popular in healthcare and why, it might be interesting to spend a second on that. And I think it's a very nascent area, but it's been studied for many, many, many decades because VR delivers this multi-sensory simulation that actually expands what's possible in mental health. And I know we're going to talk a lot about that today, the idea of mental models, what's a replacement of things, what's kind of an expansion. But I think, in many therapeutic experiences that are conducted in person, virtually, or increasingly via smartphone, in each of those models, there are still distractions, right? The patient's prefrontal cortex is hard at work. So a lot of what VR brings to the table is this complete multi-sensory takeover so that you can be entirely focused on that therapeutic experience. And we can get into some more detail on that as we go.
I have so many more questions. But of course, last but not least, Jen, so Savvy Cooperative is working with all sorts of stakeholders to provide patient insights in particular. Can you tell us a little bit more about what you're hearing from them and how your team is transforming mental health care?
Absolutely. I'm excited to share a little more. So first, Savvy Cooperative is a little bit of a different type of organization. We're actually a patient co-op, and what we do is help connect companies or innovators directly with the patients or caregivers they're trying to innovate for. So when we think about mental health, what we do is help those companies talk to people living with major depressive disorder, PTSD, schizophrenia, any number of different conditions or sort of criteria that they're really looking to innovate around, because we want people to make things that are meaningful, that will impact people's lives. And no better way to do that than by working with those communities. I can't tell you what different communities need. You need to go to the source, especially if we want to include people from historically excluded communities. It takes work to make sure that you're doing the work to reach out and hear their voices, their needs, their priorities, because spoiler alert, it's probably more often than you think that what you think people want may not actually be in concordance with their priorities. And so it really takes the job of listening and then implementing and iterating on that to make sure that it's going to make a meaningful impact.
That's so great. And I just appreciate that so much. I always tell people the only reason that I'm involved in this space is as a patient, first and foremost, starting as an anxious teen and now just as an anxious adult. But it's so critical to have that insight from actual patients for products that we're looking to impact them. Allison, I want to turn it back to you. Why is now the time for something like a Wobot?
Oh, it's interesting because there's so many things converging here that's actually coming through in what we're all saying. First of all, like the technology is so much better now than it was 20 years ago. Digital solutions for mental health have been around for more than 20 years, but where they failed or where they fell down was in their ability to engage. And I think engagement it's a very well bounded kind of word, but actually, we're really talking about deep engagement. Like as Shannon is pointing out, engaging the limbic system as well as the prefrontal cortex, engaging people in like, what is your lived experience like, which is not what, those things traditionally weren't involved in the development of interventions before now. So the technology is there, the methodology is also there, and the willingness is there. And honestly, there couldn't be a better time because, there's never been greater need for services like ours. The statistics are frightening. Depression was already the leading cause of disability many years ago. A full, I think, 10 years ahead of when the World Health Organization had predicted it would become the leading cause of disability. And since the pandemic, of course, there's, the burden of suffering has increased enormously. Some very scary statistics coming from the CDC about, for example, levels of adolescent depression and anxiety doubling. So we really need efficacious, engaging solutions that are also scalable. So this isn't about, sort of hacking people's dopamine to get them to play a game. This is really meaningful engagement at scale. So how can we improve the quality of the digital services so that we can get more people well before before their problems become so symptomatic that they really need a higher intensity treatment. And then how can you augment current treatment with some of these tools as well? Because honestly, we need to get more people well, no matter what kind of care they're getting. And we need to do that faster and in larger quantities. So I hope that answers your question. Now is really the time.
Totally. Yes. I've seen those astounding increases, adolescents and adult alike. So very excited for the work that each of you are doing, of course. And now, Shannon, I believe you alluded to digital therapeutics earlier. Let's talk a little bit more about that. Where do you see a role for digital therapeutics within the healthcare landscape in 2022?
Yeah, it's a big question and a great question, and we spend a lot of time on it. So, maybe even from a definition perspective, when we think about digital therapeutics, I really view them as these evidence-based, often software-driven therapeutic interventions. Many times they require regulatory clearance. And so it's a broad category, and I think VR has a role to play in it. But importantly, and Allison just talked about this a little bit too, I don't think VR or anything we're building should be a replacement for anything else. It's an expansion of the realm of possibilities where, for example, in VR exposures, you can immediately activate, those threat processing centers of the brain. In VR mindfulness, you can very quickly help a person kind of down-regulate their emotions, kind of calm their central nervous system. You can do really interesting things with actually just the fact that you're kind of controlling the full sensory experience. So there's a lot that can just expand the options, but none of it should be a replacement, which I think is kind of a key aspect here. But kind of more broadly about the role of digital therapeutics in healthcare, I really think about this in the context of sustainability. So in mental health, we talk a ton, as we should, about improving access. But I actually believe that you can't really improve access unless you ask a much harder question about how you build something that's sustainable. So when I think about the role of digital therapeutics, it's actually to create sustainable mental health care where, we have these clinicians who are incredibly valuable, but, to carry the metaphor a little further, non-renewable resources, right? You can't kind of quadruple the workforce in a day. So how do you start thinking about ways to build these renewable resources for mental health? What are our mental health solar panels? How do we continually access care without a premium, become more self-sufficient, become more resilient without those ongoing costs? And I really do think that digital therapeutics broadly, whether it's in in VR or on smartphones or wherever, kind of that comes in, and part of that sustainability is their capacity for built-in continual learning and improvement. So kind of really going beyond what just pharmacological and or even human treatments are capable of.
Yes, we need to think about something that's sustainable for all individuals. As many in the audience know, we're never going to have enough providers to meet the demand. And that's why we're talking about technologies like this. But, what is the strategy to keep it sustainable? Now, Jen, I'd like to ask you, you're working with not only startups all the time, but you're hearing firsthand from the patients as well. What gaps in solutions do you see that maybe perhaps should exist for mental health, but don't today?
Ooh, that's a big question. And again, my disclaimer always, I am one person. So we need to go make sure that in any area that you're working, that you would go and ask that community. But broadly speaking, I think, to what I'm already hearing from my fellow panelists here too, is that it's not just that like a tech solution can solve any of these things. And so, we work with pharmaceutical companies to digital therapeutic companies and other digital health companies as well. And it's not about any one product. When we're talking to patients, there's access issues, there's interoperability issues, there are just needs that they have, just basic needs around food and shelter and access to childcare. So there's some certain things that, maybe somebody's digital health solution are not addressing that are going to impact somebody's ability to even use one of these new tools or solutions. So we have to be aware that those things are also needs that need to be thought about and solved for to create that more sustainable mental health care model. And I think as we roll into offering new technologies to support this, there is a lot of opportunity. And that's what I find so interesting, because we are working with so many pharma companies that then also have sort of a companion app that is offering some additional support or other types of technology, that I think that we're going to combine more of these solutions, just as Allison and Shannon have been talking about. It's not replacing things, it's supplementing to provide that support. But like I say, also making sure that people have broadband access to be able to use something that's connected to the internet is a basic need that not all patients have, especially when we're engaging with patients in rural communities or people that are with lower socioeconomic status. So if we want to truly innovate for everybody, we have to think about the additional sort of barriers they have to be included in this new wave of innovation.
Yeah, there's so many cool apps and technologies that are quite efficacious, perhaps, but if they don't even have the resources they need to even get to the stage to adopt them, then of course that's pretty challenging. So really want to keep that front and center for a lot of the innovators in the audience who are listening, or those looking to implement these kinds of technologies. We've been coalescing around a topic of, do we see tech replacing existing systems or even replicating, but just in digital form? Or is it something completely different that we need to do moving forward? I think I'd like to ask each of you that question, maybe starting with Allison.
Sure. This is a topic I talk about a lot, because I think, in the early days of Wobot, there were a lot of sort of press headlines like, AI is coming for therapist jobs. And it was really because on the face of it, you have a sort of a technology that's interacting with you through, conversation, and it may come across like a lot of therapeutic conversations that you would have. But that really misses the point entirely. It's to solve this mental health crisis, it's not about making AI therapists. It's about empowering people with better tools earlier on in their mental health journey and making them truly accessible. And I love how we're all talking about access as this, it's a multifactorial issue, like it's a very multidimensional thing. But yeah, it's really interesting, because I think the thing that's often overlooked, and the frustrating thing about talking about AI replacing therapists, is that we sort of miss the conversation that's much more fruitful around, like, what are the net new opportunities that technology afford us? And there are really interesting things that technology can do that, frankly, that humans can't do, right? A human therapist is actually not going to be with you at 2 a.m. when you wake up and you can't sleep and you're feeling panicked. an AI can do that, right? And also a therapist can't, as Shannon said, not to speak for you, Shannon, but can't control the entire sensory experience, right? Technology is offering us a set of tools that were not before available, and it's a really exciting time. At the same time, I think we're all making the same point as well about understanding the role that we play and understanding the limitations as well. So, I think you'll see all of the winning digital therapeutics companies having really well-defined, a really well-defined understanding around this. And that allows us actually to sort of partner in conventional health systems. So, because we're not trying to solve every problem and think, oh, this is a thing for everybody. This is not what we're trying to do, and I think that's the thing that makes us successful.
I know, Shannon, you touched on this a bit earlier, but if you or Jen also have anything to add.
Yeah, I would add a couple of things. I mean, something about even the term itself, digital health, is kind of funny because it's very easy to think, okay, health, and then you make it digital, right? And so like that almost implies this level of kind of substitution versus the complement. And so I think that, breaking that mental model of the past, or that there has to be one or the other, is really important. And I think the potential to create brand new offerings enabled by AI that would otherwise be impossible, like Allison said, is huge. Like, imagine that through a digital therapeutic, it's as if every time you took a pill, that pill learned and improved, not just for you, but for everyone else in the world who is taking that pill. Or every time I see my therapist, they gain insight that could be applied in that moment to everyone else in the world in a therapy solution. And those are the kinds of things that digital interventions, AI, digital therapeutics, digital health, whatever you want to call it, can really enable. And then you can have in-person therapy and virtual care and Wobot and behavior, and then thousands of other things that haven't even been dreamed up yet, right? Because we have to, because that's what it's going to take. It's a huge issue.
And I think to build on that the things that we hear about too is that let's take communication and how people want to be engaged with. And I know that Allison and Shannon have touched upon this a little bit, but our patient participants will tell us different things about how they're okay getting certain types of informations from things like apps or technology or chatbots or these kind of things. But others, they want to get on the phone with a provider or somebody from an office and staff. So it's understanding the nuance, and that's why I don't think that it's replacing the existing systems, but it's supplementing it to make sure that somebody can get the information they need or the support that they need, and then also making sure that we are fully aware that there are times that I don't want to say the existing systems because there's still a lot of things that can make that cumbersome, but the concept of being able to talk to a clinician or another sort of team live, if you will, is still advantageous. So it's finding that balance, and depending on what you're doing, thinking about, how are you going to get feedback from that patient population about what makes sense in different places, and always keeping in mind that patients are not monolith and therefore they have preferences. And so how can we also use technology and other types of resources to put that optionality in the patient's hands so that they can make the best decisions for them and their families?
We're marching toward more personalization with all of these new tools, but we're really talking about things that are different and new and bigger and leveraging the resources that we have so much better and more scalably than ever before. It's really exciting, but it's not all ponies and rainbows. There are some barriers. So I think I want to pivot to that next. We've been talking about the potential of a lot of these new solutions, but what are some of the barriers that are standing in the way of having all of these technology solutions to be more prevalent? Maybe Allison, I'll go in the same order. How about whether it's from the standpoint payer or direct to consumer?
I think, it was interesting just to pick up on something that Shannon said about, digital health and the fact that we're sort of trapped in an old mindset to some extent. It reminds me of an anecdote that I heard that when phones came out, they talked about them as a talking telegram, right? Because people didn't have a model for what a phone was. And so I think to some extent, one of the barriers that we have is being at the forefront of a new technology. It does mean that you must be really responsible and you must communicate a lot about it, but there aren't mental models for people for how this fits. And so it's sort of on us to communicate really well and frequently, and frankly take the time to do the studies, right? Do the science, do the research. And honestly, I think that takes time to create something that's meaningful and sustainable. It's hard. It's and responsible. It's hard and it takes time. And so, in a world in which, I think other technologies, I think we're fortunate, certainly at Wobot Health, our investors are very patient and they understand that this, has the potential to be a really important technology. So they've allowed us to have sort of the time and there's no pressure to grow and things. But of course, that's, for a lot of newer technologies, I think coming on stream, the pressure to grow quickly and things can place an undue pressure to cut corners, and that is absolutely what this field cannot do. There are two things that come to mind immediately.
Yeah, I could maybe piggyback on that a little bit, looking at maybe through the lens of some of the adoption challenges and opportunities with payers, with health plans, because I think that especially in the digital health, digital therapeutics space, for prescription digital therapeutics, there's increasing clarity on regulatory pathway. Many prescription digital therapeutics are getting cleared, are coming to market. But I think there's a question for both digital health and PDTs about how do we make sure that we are delivering that proper level of evidence that payers expect. And Allison mentioned it already takes a really long time to build these things in a way that is responsible and right. And then there's a need to really kind of deliver this data, all of the proof of clinical efficacy, the value, kind of the economic value as well, for many of the payer audiences. And I think that, for us, we've talked a lot about how there actually might be yet another opportunity to break out of some of our mental models of the past. I guess that's my theme of the day. And maybe drive a different way of thinking about adoption for payer audience. So, what if there's an opportunity to truly enable value-based care with payers through digital therapeutics? If you're a payer, what if you could finally pay based on value? X for enrollment, Y for engagement, Z for outcomes, right? And so I think that, that's just one example. And I think time will tell which models, bear the most fruit. But I think there is this other opportunity more broadly to, again, think differently about how to bring things to market, how to deliver value, and how to get paid for it.
Right. Just as Jen had said earlier, for patients, payers also incentives need to be aligned across the board. So yeah, Jen, go ahead.
Yeah, I'll add from sort of the patient and consumer standpoint, there's a growing awareness around how data is actually being used. And so people do have privacy concerns. We've done a lot of work trying to do sort of a landscape assessment, understanding how patients feel about their health data being shared. We know some people are, game to jump in and use things like wearables and whatnot and download any app. But some are very reticent to do it, and for, valid reasons that they know that their data is being sold and monetized in different ways. And that's one aspect of it. But there's also concerns around what does it mean for them and their families should their data about very stigmatized health conditions be shared out in the open, and not knowing where that data is going. So the more that companies can be thinking about how are you communicating that upfront to people as they're downloading your app, how are you walking them through a more informed consent process as opposed to, click the terms of service, you have to agree, otherwise you can't use this thing, and then never talking to them about how their data is going to be used. So if you want to gain the trust of the people that are using your service, app, solution, being really upfront about that. Something that I am personally very curious about as digital health tools have been on the market now for some time, and we're seeing more M&A action happening, thinking from a patient standpoint, if I opted in to share my data with Wellbot, let's say, and Wellbot then had a partnership or was acquired or whatever the relationship may be with another entity, what is happening to that patient's data? And do they have to opt in again to share that off? Because we know that data is so valuable. So that's why people, are gobbling up companies. But think about the individual, and did they really, of course, yes, they consented by the terms of service that they agreed to, but not in an informed way. So we're going to see more of that happening. And I'm concerned that there could be some detriment to the patients when that does happen, if the new parent company has different plans than the company that they originally shared their data with and trusted.
Yeah, that's right. We did, just to add to that, like I think the European, I'm sitting in Europe at the moment, and the GDPR approach I really think is correct. The sort of the principles around, well, first of all, you talked about informed consent. The days of sort of legalistic language of T's and C's are gone. You have to sort of plain English describe how exactly, the data will be used for each and every use, and you're not allowed check the box by default, so that you really must do a really good job here. And I think this can only be a positive thing. The other developments here is, the right to be forgotten. Before GDPR came on board, we allowed, invited our users to just tell Wobot if they wanted their data to be deleted. And that was a really nice, like, sort of plain English thing, because we have to move to this place of the person owns their data and they have control over it. I mean, I think we are rapidly moving in that direction, because frankly, people are becoming more discerning, and so they should, right? This is a really important issue.
I'd also like to add, and maybe it's just me personally, one major barrier is engagement, frankly. I'd love to hear from each of you. At this point through the pandemic, a lot of buyers of solutions are starting to try different, especially mental health technologies. But if you can't get folks to use it, then or engage in the solutions, then what's the point? So, we'd love to hear from each of you to talk a bit about engagement. How do we develop new solutions that are designed to really fit patients' needs first and foremost, so that they're excited to use it?
In lots of ways, it is the question for digital mental health in particular, because, the interesting thing about struggling with your mental health, and particularly something like depression, is that it's almost a state of disengagement, and, anhedonia is a really prevalent feature. So, I think for us, we think about what is meaningful engagement. And so I think, we're not trying to just have people sort of aimlessly swipe and click so that you can, report on, well, we've X number of daily actives. That those metrics are the wrong metrics. It's not about optimizing for attention. So it's about, how do you encourage a person to show up in a meaningful way such that they can really engage in a therapeutic process, what is often a really difficult therapeutic process, honestly. And then, with the aim to be able to, show them that they can use their own resources to feel better in a given moment, and then come back whenever it's ready for them, right? And I think so we've been doing some really interesting modeling around what that sort of longer term, what those engagement arcs look like, because it's not about just like, how long can we keep people in? And that's the wrong thing. You just want to be there for somebody when they need you. That's certainly, as a relational technology, that's what we aim for.
Yeah, and I can add on to that a little bit, because I think about my role at Behavior is figuring out what is that perfect balance between these highly engaging game-like experiences and kind of the truest, most clinically validated kind of therapies that need to be in the experience. And so it's an interesting conversation we're having all the time, because I think that clinical validation, that's just table stakes. But then we have game designers on staff. Like, you have to have those kinds of people who are like pushing the conversation around, this may be clinically correct, but it's not going to actually deliver the clinical efficacy we're looking for, because it's stale, right? It's not something that people want to keep coming back to. And so I think, from our perspective, luckily, VR has a bit of an inherent engagement and immersion aspect to it by its very nature, but you have to get people back into the headset. So that's where a really thoughtful integration with companion apps, clinical oversight comes in. But one of the things that we've done is use this approach called game thinking, which is all about how to build an engagement science. So it combines game design, systems thinking, kind of agile lean UX, design thinking to help you build these deeply engaging experiences as journeys. So it's not just, they're in there, how long do we keep them? But how do you make them feel like they are part of a journey that they want to keep coming back to? And as one aspect of that that's been really valuable for us, there's this concept in game thinking of super fans. So individuals who have a need for your solution, they're motivated to help you shape it. And we actually work with dozens of super fans to test storyboards, prototypes, brainstorm ideas, kind of let the people that we're building for actually help pull the product and the experience out of us. And the ideas that these super fans have actually brought to us about what would make them come back, what kind of reward systems would be motivating and meaningful and kind of value added are actually shaping the way that we're building the solution kind of on the back, obviously, of that like fundamental clinical core in a way that I think is going to hopefully bring something that shows you don't have to pick one or the other. And that's a really important aspect and kind of belief that I have about product development in this space.
Yeah, and I think I love that you're doing that, because the question around how do we develop things that matter to patients, I direct you to the sign conveniently placed behind me, which says ask patients,
Right.
Subliminal messaging for every conversation I'm part of. And that's exactly it. We want to actually talk to the people that we're trying to create things for. One thing I would note too is sometimes you're working with those people that are already very versed in what you're doing. And sometimes too going outside of that to understand, well, why aren't we capturing other people? And maybe what is it that's missing from our product that is not entice them to engage with it? Another thing that I think about too, when, it was mentioned around, it might be some of the same sort of themes and clinical science that these different types of products are based upon, but how are we delivering them? And, we've worked with so many different digital therapeutic companies. And one of the things that we've seen is that, yeah, it's the same concept, but sometimes they come to us in our patient network with, hey, we actually have 3 or 5 different options for how this gets deployed. And getting feedback on the different ways that those could take shape so that they can tailor it to what the community is sharing. And this can be around, what's the level of engagement and do they want to gamify it? But we've heard patients even say things around I'm suffering with a serious condition here. I don't want it to feel like I'm playing Duolingo and there's a little bouncing owl, jumping around. I have a terminal illness, these kinds of things that they want it to fit where they're also at in their journey and not be flippant about, what that experience is. And that, I think, while we can learn a lot from the gaming community, it's also just being really respectful about where that patient and their community is at. So really designing it with them so that it doesn't go to market and people are like, these people don't know what they're talking about. So being really, really thoughtful about the design approach is important as well.
Yes, meeting people where they're at. How else can you see success without doing that? So thank you each. Really great explanations. I have so many more questions that I want to ask you each, but I know we're coming up on time. So definitely you're each innovators in your own right in this space in mental health technology and innovation. Would love to ask each of you what your hope for the future of mental health care is and where do you see things going? So Allison, not to put you on the spot.
Yeah, my hope is that, we continue building in partnership with patients and in real world settings. So I'd love to see the continued sustainable adoption of digital therapeutics and people continuing to have an open mind about their role. So, so that we can really figure out and have just a really rich ecosystem of services that are available to people, all people, very inclusively, because that is really what it's going to take to reduce the burden of suffering in the population.
Yeah. And I would add, my hope would be to create a new focus on sustainability and mental health, not feeling like we have to build only things that rely on these limited resources. Let's harness the possibilities behind AI and other technologies in a way that is responsible and respectful to a lot of what Jen was talking about. But we need to build things that learn as they go, or that can help millions versus just one. And so I really think that if we challenge ourselves to be far more expansive in our thinking and leave behind some of those mental models, we'll have created more sustainable solutions in the next 5 years than we have in the past 1,000. And so I think, that's really kind of the call that I would have for the industry, commit ourselves to that.
Yeah. And I think to build on these concepts as well is just taking it back and understanding that mental health typically is very stigmatized still. And though we've made a lot of progress, until we can get over that hump, whether or not there's a new tool that people are excited about in the industry, people who feel like the system has failed them before, that hasn't supported them through either access to therapy or, other types of interventions and drugs and pharmaceutical interventions. And now you're telling them there's an app or some type of technology that could work for them. They just may be sort of disenchanted by the entire system so far. So really thinking thoughtfully about not only what are we building, but how are we providing enough sort of social support and education to make it so that people know that there are solutions out there and that we are here to help them on their journey. And so I think we have to get over that part of it as well. So hopefully in 5 years, we'll be there. Hopefully sooner.
These are all really wonderful. And I know that our audience has been inspired by each of you, but I think it's really important that people have some tangible takeaways that they could actually move forward a few steps, if you will, on how to actually implement the visions of what each of you have just said. So if I could challenge you with one more thing, what are 1 to 2 tangible activities that audience members can take to actually put each of what you just said into action, please?
Oh gosh, I don't know that this is tangible, but I think this is the sort of the advice I want to give when I talk to entrepreneurs. It's, everybody, people talk about, being an entrepreneur, it's hard, it's hard, it's really hard. And I don't think you really understand how difficult it is, like how hard it is, but it's supposed to be hard. It is supposed to be hard. And my advice is to lean into that difficulty and the pain. That's where the learning is. And it really should be hard. If you're doing something meaningful and important, it will be difficult, and just lean in. That's my lean into the difficulty. Yeah, that's where all the growth is.
I love that. Well, so then maybe I can frame mine more around to the pharma biotech companies, payers who might be listening. I think maybe my ask would be moving into more of this yes and mindset, and kind of watch out for false choices, because we've already talked about how we don't need to see this as replacing clinicians or even replacing the pill. And I think that we tend to view things in these binaries. Do we reimburse for this or not? Do we solve this with a pill or a DTX? Do we do this in person or via telehealth? And they really are false choices, because there is always a more expansive set of options, which all the entrepreneurs are really focusing on building for. Like, they're coming, they're out there and they're coming. And now is really that moment of being able to think more expansively. So I guess the tangible ask would be, every time you come upon what seems like an either or choice, reject it as such, and really take this yes and approach instead.
Well, my final sort of 2 pieces of advice is, 1, to ask patience. And that's also my number 2 is ask patience, please. And I just think that that's what we're going to co-create the future of mental health care together when we do that. So that's what I would want to leave people with.
Fabulous. Each of you, thank you for your time and expertise. Allison from Wobot, Shannon from Behavior R, Jen from Savvy Cooperative. I hope that everyone in the audience, that you'll go ahead and learn more about the amazing work that each of them are doing around transformative technologies to impact mental health care. Thank you each for your time.
Thank you.